Dr. Kris Gast is back with us for the third time with Fort Smith Radiation Oncology, which is the only independent, locally owned and operated radiation cancer treatment facility in the River Valley. She joins us this morning with much more, and we've been talking. This time we say it is specifically geared toward the men.
That's correct.
Now, there's been a scary headline for a lot of people. New information just coming out this week. It's regarding aggressive prostate cancer, where researchers say they found that men who died of prostate cancer were half as likely to have taken a statin than a control group. Now, sounds scary. Set the record straight for exactly what they did and what this means.
Right. That is very scary. It makes you think that you need to run out and start taking statins just off the shelf, that it needs to be started right away. But when you look at the actual study and the information in that, the researchers did a chart review. It wasn't actually a randomized study. They reviewed 380 charts for patients who had prostate cancer and died from their prostate cancer. And then they reviewed 380 charts for patients who had prostate cancer or had not died from their prostate cancer. And then they looked to see, who had taken statins and who hadn't. And they found that the men who had died of their prostate cancer were half as likely to have taken the statins. Now, when they looked at the information in the study, they're not able to tell us whether they started taking the statins before their diagnosis or after. So it's very limited. It's very difficult also to separate out numerous other factors. Were the men that, when they were placed on their statins, did they change their diet and start exercising as well? And did that play a factor in changing their overall incidence of dying from prostate cancer? So it's a very limited study and not necessarily one that would change what we would be doing with our patients right now.
You would assume there would be much more research, more in-depth, rather than, as you've called it, a chart review. So is it possible statins do not prevent cancer at all?
That's correct. Some of the leading researchers in prostate cancer have reviewed it and have really commented that at this point in time they really don't feel that this is an indication to do anything different. They really don't feel that it's a factor taking statins will have any impact at this point. It is a factor in terms of looking at that, at perhaps setting up a study which would require a large number of men who would be randomized to either take the statins or not take the statins. They would be followed for many years, and you would see which group did better. And then that would be the basis for recommending statins for patients.
And I know another big question that people have is, how could we determine if statins did protect against aggressive prostate cancer?
Right. You really would have to proceed with a study that would be what we call a prospective randomized, which in very good trials, patients are put on double-blind trials where even the doctors and the nurses that are working with them don't even know who's getting the medication and who's not. And then they have to be followed for many years. And I think with the drug that we're looking at, that category of drug isn't without side effects, and it would be something that patients would have to really be followed in terms of determining if it was an important factor or not. Because it's costly, both side effect and money-wise.
This is just the tip of the iceberg here.
Exactly.
Now, researchers' recommendations are men who are heart healthy should not be placed on statins for the purpose of lowering prostate cancer. What do you say to that?
I think that's exactly right.
So there is all of the information on this new study, which Dr. Kris Gast says more of a chart review, so we're not running out and taking statins off the shelf.
No.
There you go.
Not right now. So,
and of course, there will be a lot more to come out of this, and hopefully a lot more research done as well. Now, today we're just talking about statins, but it's also linked to the prostate. You're going to come back and give us a lot more details coming up in the next month or so.
Right. I think in 2 or 3 weeks I'll be back, and as long as there's no other studies that come out between now and then, maybe we can just review just basic standard treatment for early prostate cancer.
Well, then we hope that you will come back and meet us up here for that. Dr. Kris Gast is located at 8500 South 36th Terrace in Fort Smith. It's the Fort Smith Radiation Oncology. There are the phone numbers that you can call, also that toll-free number right there. You can also find them online. Dr. Kris Gast and everyone there at Fort Smith Radiation Oncology at fsro.net. We always learn so much when you're here, Dr. Gast. Thanks for being here.
Thank you.
This is 5 Sunday Morning. We'll be right back.